Is Dr. Rebecca Gilbert, and I am Chief Scientific Officer at American Parkinson's Disease Association. Thank you so much for joining us today for our Dr. Gilbert host series, during which we are going to be discussing important issues regarding the COVID-19 virus and how it has impacted the Parkinson's disease population. American Parkinson's Disease Association, or APDA for short, is the largest grassroots network dedicated to fighting Parkinson's disease and works tirelessly to help the approximately 1 million people with PD in the United States live life to the fullest in the face of this chronic neurologic disease. Please visit our website at apdaparkinson.org to explore all that we have to offer. This includes programs and services delivered by our network of chapters and information and referral centers located throughout the US. Our website also hosts a vast array of information, publications, webinars, and articles that can help you understand your Parkinson's disease. Another way to contact APDA is through our toll-free hotline, 1-800-223-2732. And now for today's program. Today we will be discussing advanced PD and COVID-19. For the purpose of today's discussion, people with advanced PD are those who are no longer independent in their activities of daily living and require help for their self-care. Advanced PD presents unique challenges in the face of both social distancing and staying safe from this virus. Many patients and their care partners have specific questions about their situations, and they are seeking answers. My guest today, who will help us answer some of those questions, is Dr. Pravin Khemani, a fellowship-trained movement disorders neurologist who works at Swedish Neuroscience Institute in Seattle, Washington. He treats patients with Parkinson's disease and their care partners, as well as a wide variety of other movement disorders. He works closely with the Northwest chapter of APDA to do outreach and community education for Parkinson's disease. Dr. Khemani, thanks so much for being here today with us. We have a bunch of questions that have already been submitted to us that we will be discussing, and we very much want to hear from you who are currently listening. And if you have a question while you are watching this live, please feel free to enter it using the question and answer feature on the bottom of your Zoom app. And so now I'd like to turn the mic over to Dr. Khemani to address you as well.
Thank you, Dr. Gilbert. I hope you can hear me okay. It's truly an honor to be here with you. And I would like to start by thanking the American Parkinson's Disease Association, both the national organization and our chapter at the local level that is working closely with the national organization to address our patients and their caregivers in this time of need. So I'm thrilled to be here, and I will share whatever information I've gleaned about advanced Parkinson's disease and COVID over the past few weeks since we've been collaborating on this project. Thank you.
So let's just jump right in and start with our first question. And I think this is one that many people out there are grappling with. They feel in their bones that advanced PD must have some relationship with this virus, but why is it that someone with advanced PD is more at risk or should worry more about COVID-19 than someone of the same age without that condition? Can you help us address that basic question?
Well, I think we've discussed this in this past, you and I, and we've also looked at the literature. I didn't find anything that suggested that people with advanced PD specifically were at a higher risk of contracting COVID-19. But in our literature search and conversations, we determined that it's perhaps the convalescent stage, which could be longer if someone with advanced PD has COVID-19. They can be immobilized for a long period of time. That can lead to deconditioning and further worsen immobility. And so therefore, we do not want anyone, especially people with advanced PD, to contract this virus. And I'm going to pause here for your thoughts, Dr.
Yeah, we have been discussing this particular issue, and I think that's a very, very important point. Anytime that somebody with advanced PD gets any illness, we worry that there's more of a difficulty getting back to their baseline, and it's longer and more arduous, and that's certainly something that's on our minds about this virus as well. Um, again, I want to reiterate what you said. We do not think that people with PD have a impaired immune system and that they will contract the virus more readily. But it is certainly possible that once they have it, as we said, the convalescence will be longer, but the actual disease may be more difficult as well, considering problems with clearing secretions, problems with taking in deep breaths if somebody has um, a rigidity of their core muscles that may impede their ability to take in good deep breaths to clear the secretions of the virus. And those type of issues may impact the actual disease as well. And then, of course, people with PD are often in the age category alone that increases risk once COVID-19 has settled in. So for all those reasons, we are very concerned about people with advanced PD contracting this virus. I think we're going to jump to the next question, which has been given to me in many different ways with many different themes. And that is that people with advanced PD often have aides that come into the home to help in the care of people with advanced PD. And what does a family do to protect the person with PD and everyone else in the family if there are multiple people coming in and out, potentially being aides to people coming in and out of many different homes? How to navigate that? Do they cancel all aides? Do they continue as normal? What advice can we give to families in those situations?
Yes, and such an important question because people with advanced PD and people with any chronic illness who are dependent on home health aides should continue to get the help they need. And this prompted a search on what are the rules and regulations with respect to home health aides and taking care of advanced PD and chronic illnesses. And they aren't anything specific, but the CDC has a great webpage that tells us about universal precautions when someone is coming to your home and taking care of your loved one with advanced PD. And we'll be happy to share that link. And I would just want to say that home health aides are truly one of the unsung heroes of the healthcare system. They are essential to keep our loved ones safe, secure, and take care of them. So we should also invest in their own health. A lot of them are using their own PPE, etc. But whatever we can do to assist in keeping the home health aide safe as well as your loved ones safe is a great, it would be highly appreciated. The National Association of Healthcare and Hospice has also come out with some guidelines on what we can do to have home health aides come over, but also to ensure that people are not getting infected due to this foot traffic in and out of the house.
Yeah, I mean, I think that's an excellent point. We have to balance the needs of the patient. You know, if all home health aid activity stops, then the burden is falling on the caregiver. That isn't necessarily safe. There can be increased fall risk and other sort of unintended consequences of doing that. And so, practicing good hygiene is probably the way to go. As meticulously as you possibly can. We now have a question, a live question, that's actually coming from Tokyo, Japan. Thank you so much for joining us. And the question relates to a worry that the coronavirus may interact badly with her mother's medications. Specifically, her mother is on levodopa, Azilect, Comtan, and Nupro. And do we think that any of those medications are a problem specifically if a person has coronavirus. What are your thoughts, Dr. Khemani, on that?
We simply don't have enough information to determine if the coronavirus itself interacts with medications. And you and I did a literature search to find out about the numbers of people with Parkinson's disease who were affected with coronavirus. And I think we just found one case study in which the person or the patient who was affected also had other comorbidities, and therefore they were more susceptible to getting the disease. But what would happen, I'm thinking, is the indirect effect of absorption. When you're sick with anything, including a respiratory illness, your bowels move sluggishly, and we do know that a proper absorption of medication in Parkinson's disease is very important. So it could be possible that potentially that you may not absorb your medications as well as you would in other times that you are sick. But I really am not aware of a direct interaction between the virus and the medications themselves.
Yeah, neither am I. So hopefully there isn't one. A related question that we were going to address later, but we could address now, is that a patient asks the question, what happens if, God forbid, I'm on a ventilator during the COVID-19 virus? How do I get my medications in that situation? Obviously, that's an extreme situation. And as we know, most people who do contract the virus could be completely asymptomatic or have milder symptoms or symptoms that are more moderate but do not require a ventilator. A small percentage do unfortunately require ventilators. And in that case, in those severe cases, what happens with the taking of Parkinson's medication?
Yes, it's a very important question. It's one of those things which is a hypothetical scenario, but it is an important one to address. I do believe that neurologists, movement disorder specialists, are always on standby when one of their patients is admitted to the hospital. But in case a neurologist is not there to direct how to optimize medications, a few pointers, and our neurohospitalists and doctors are very well aware of it, that supplemental feeding through nasogastric tubes and percutaneous endoscopic gastrostomy tube or PEG tubes is always done for people who are on a ventilator so that they can get their calories. Those same routes can be used to deliver medication as well. And it just must be made clear that the medications shouldn't be given at the time that food or high protein is delivered, or the medications wouldn't be absorbed. So we routinely have people who have other medical problems, who have Parkinson's disease, who are on ventilators, who get their medications on time and actually do very well with respect to the Parkinson's disease itself.
Great, great. So should that scenario arise, there is precedent for treating people with Parkinson's disease who can't take medicine by mouth. And hopefully those protocols will be followed in these situations as well. We have a couple of more questions that are coming in live. This is an excellent question that I think probably many people out there are wondering about. What if a patient, or presumably somebody with Parkinson's disease, who does not have a caregiver, so presumably typically a person who has some PD symptoms, but not enough to require an ongoing caregiver, gets the virus and can't take care of themselves? Will we need to be hospitalized when in another situation we would not have had to be hospitalized? That is an excellent question. I'll let Dr. Khemani take a crack at this one.
It's a very difficult situation, particularly when you're not able to take care of yourself. I would see that as any situation in which someone with Parkinson's disease has an illness in which they're not able to take care of themselves. That would be the time to ensure you're communicating with your primary doctor, your neurologist, and having them care coordinate for you. And that's what we do a lot, is we try to find resources for our patients and caregivers who are not able to take care of themselves, and we advise them, oh, do you need to go to the hospital? Do you need to go to a nursing home? And these are exigent circumstances, in the sense that if you're not able to take care of yourself, you do require help, and help is available. It's not that the hospitals and the emergency rooms are closed to people who don't have COVID. In fact, as you and I both know, Dr. Gilbert, we are in this situation with stress resources because we still continue to take care of everyone who needs to be in the hospital, as well as people with COVID-19. So I would say you would start with your care providers or your physicians or your NPs, and take advice from them and what's the best way to get yourself taken care of.
Yeah, and I would add to that that maybe right now would be a good time, now that you are able to take care of yourself, you don't have the virus right now, you're concerned that you're going to get sick. Perhaps now is the time to identify somebody who would be able to be with you in your home, should you get the virus, to take care of you, to avoid having to be hospitalized in that situation. Obviously, no easy answers here, but something that we all are aware of. And as Dr. Khemani said, this is not COVID-19 is not a unique situation. If a person with Parkinson's disease, who typically manages to take care of themselves, gets any illness, then it can be more tricky, and there might be more involvement of the hospitals and other rehab situations than a person who has a care partner. And so this is an ongoing question for people with moderate PD symptoms. So thank you so much for asking that question. We have another question coming in live, which is something that has been asked in other forms previously, that we were going to get to on our list, but let's address that right now. And that is, do we need to be concerned, or how do we address the concern about the increased potential for depression or even cognitive decline in the setting of not just the virus, the worry about the virus's social isolation? How do we address the potential for those increased non-motor symptoms? Dr. Khemani.
Yes, and we had discussed this previously as well. I think we need to unpack this a little bit. Cognition, mood go hand in hand, but they are a little different. They're different, especially in Parkinson's disease. Let's talk about mood, and perhaps I'll have you talk about cognition and neuropsychiatric symptoms, Dr. Gilbert. Whereas mood is concerned, we know that these are extremely stressful times, anxiety provoking times, whether you have Parkinson's disease or not, due to social distancing. Some people feel socially isolated. There are people who think that they cannot go out because of coronavirus. So let's talk about this in terms of being connected with people. One of the things that APDA has done so well is, on their blog, they have so many different avenues they have posted of being connected with one another. As we have talked about it previously, social distancing does not mean social isolation. And there was a question earlier, I think the person was concerned that they wouldn't be able to go out. Well, if you want to go out in your yard, no one's going to stop you, obviously. It's your yard. But if you really want to go out and take a walk in the community, then you can do so. You can absolutely do so. Maintain a safe distance. If you don't have a mask, use a cloth or a scarf to cover your mouth. There's no reason to not be able to go out. And we do know that staying connected, going out and getting your exercise decreases anxiety, is very important for mood. So those are two very important things that we can do. The other is, again, I say connect with your primary care provider and neurologist. It is entirely possible that mood-related medications may need to be optimized. We treat mood and anxiety in Parkinson's disease constantly, so it can also be pharmacologically be treated. So there are non-pharmacological ways, non-medical ways of ensuring that you have a centered life. and also pharmacological ways. So it's usually a multi-pronged, multifactorial sort of an approach, and it is effective. We also have telehealth these days. So it's not like you're disconnected with your mental health provider in several places. It is available. You go to the CDC, and there's actually a national distress hotline that is available that you can call. And last but not the least, if you really think you're in a place where you're going to hurt yourself, your mood is not very good, please call the National Suicide Hotline. That number is also posted on CDC, and it's there for a reason. So, I think I've said a lot. That's a lot of information. I'm going to stop now. And Dr. Gilbert, you can address the neurocognitive issues, if you may, please.
Sure. I think that one of the very important things people are worrying about is that during this period of time where they're not engaged in the same way, either with exercise programs, with social interactions, with any other activity, there's going to be a decline and not an ability to return to baseline, both physically and mentally. And there's many questions have come in along those lines and with worry about that. And so it is important to try to maintain as much interactions and as much activity as possible. And one thing that I keep telling people is make a schedule. Don't wake up in the morning and assume the day is going to be filled. It won't. And the worst thing you can do for yourself is not have some activities to look forward to and activities to draw you in. So make that schedule. Wake up. You're going to do, make your breakfast. You're going to go take that walk with a proper distancing and a face covering, staying 6 feet away from everybody, getting that walk in, maybe doing a little exercise by yourself outside, getting that in the morning, coming back inside, maybe doing a Zoom chat with your grandkids, then doing some gardening, then playing Scrabble online, then doing your exercise in front of your let's say a Zoom class that you have organized or some other exercise video. So there are many things that you can arrange to build your day, to keep yourself active and engaged, because that is probably the number one way to stay cognitively intact, is to keep that brain working all day doing different things. Reading, of course, etc. Somebody with advanced PD, which is, of course, our topic for today, this is harder, obviously, and that is going to require the help of other people in the household to get that person as engaged as possible. It is not easy. Obviously, much easier when you're able to go out, when you can have more stimulation coming in, but it is something that, with effort, can be improved little by little. So try your best to keep mentally and socially engaged. That would be my advice.
Dr. Gilbert, I'm sorry, I didn't mean to interrupt, but I had a thought in my head that I wanted to get out there. We assume that a lot of people have access to internet, to Wi-Fi, etc., and are able to use technology. But if you don't have to worry. In fact, our Northwest chapter here did something really inventive. They have a helpline, which is a phone for people who need to learn or know how to navigate technology and get on their website and get connected. So that help is also available through the APDA.
Okay, we have a related question that has just come in. And hopefully you can still hear me, because I'm being told my internet connection is unstable. Can you hear me okay? Are you able to keep hearing me? Can you hear me?
I can hear
you. So let me.
Thank you.
Okay, great. So a related question that has just come in is an excellent question, and this is one that has permeated many of our questions, and that is, I live alone, I have PD, and usually I'm independent, but I have an adult daughter with kids and a husband. We've been separate for 3 weeks. Can we move in together? Great question. Dr. Khemani, would you like to take a crack at that one?
Well, you can move in together, but universal precautions need to be absolutely maintained, particularly with asymptomatic carriers. The daughter and the kids could be asymptomatic carriers. So for the duration, While the curve is being completely flattened, social distancing must be observed at home as well. It's difficult. We've seen some heartrending images of grandparents on one side of the door and kids on the other side of the door. What I tell people, it's temporary. At least you have your family with you, even though you cannot touch them and be physical, like hug your kids, etc. But these are trying times. I think it is very important to protect your health. And so please maintain that social distancing, even in the same space, and the universal precautions that I suggested, and an entire list of those, from washing hands to putting on cloth masks, to doing laundry separately, to not sharing dishes, to not sharing drinks, etc., can be found on the CDC. So what we are trying to do is just minimize transmission of this infection.
Yeah, and I'll add to that. It was particularly difficult over this last weekend with Passover and Easter converging, and many families celebrating independently, and asking this very question. Wait, I've been under isolation. They've been under isolation. Why can't we join forces? And the bottom line is, we do not live in a hermetically sealed world. You're probably getting deliveries. You're probably going to the grocery store every now and then. And all these things can bring in the virus, and your dog, because they're asymptomatic. And that's where the danger comes in. So when we're looking to flatten the curve, we really need to, you know, do the best we can. Now, in an ideal situation, which is not really humanly possible, every single individual, children included, will be living in a house by themselves and not go out at all. And those things are not possible. So we're doing, a little bit, so we do have family units together. We are allowing people to go to specific stores to get food and drugs, but we're really trying to do the minimum possible. And so hopefully this won't last terribly much longer, but following those rules are so very important. Thank you so much for that question. We have a number of more questions. It's getting up to the half an hour, so we're going to take a few more of these. And this is a really excellent question, and it applies to many people with PD and other illnesses. So in this specific question, the asker asks, my husband is prone to urinary tract infections, and these have led to hospitalizations in the past. I really want to avoid the ER and the hospital because of COVID-19. Is there anything I can do now to try to prevent the next urinary tract infection?
Yes, a really good question. And I remember we had discussed this question previously because it's a very common one.
Yes.
I think we can break it down into prevention and treatment. And the first thing is important to recognize that urinary tract infections can be prevented. And in our search, we found out that the Harvard Health page has some very good fundamental tips on prevention of urinary tract infections, whether you've got PD or not. And they can be broken down, and we'd be happy to share that link with you. Basically, to summarize it, cranberries and any other kind of berries that you can get your hands on have shown to decrease contracting urinary tract infections. Hydrating significantly, hydrating really well is very important. Vitamin C doses of about 1 milligram per day, and probiotics are all of these measures that Harvard Health suggests in terms of prevention of urinary tract infections. And for the treatment aspect, I'm going to hand it over to Dr. Gilbert on what can be done if you actually contract it and you have to have it treated.
Yeah, so two of the things we were talking about is that it's probably a good idea to contact your neurologist and or your urologist now, or your husband's urologist, because there may be prophylactic antibiotics that the urologist is willing to put your husband on in advance because of this specific situation that's going on. And also, if you are very familiar with what a urinary tract infection looks like, smells like, or does to your husband, your urologist may be willing to write a prescription of antibiotics that you keep in your house, and under advisement, maybe a telehealth visit if the symptoms arise, to initiate that prescription to try to keep your husband out of the emergency room. So there are some things that can be considered. Obviously, we can't give you formal medical advice, but something to keep in mind. Thinking ahead and trying to plan ahead may be a good idea. And this would apply for other medical situations that people may find themselves in. If they know that there's a pattern that develops, trying to get ahead of that is a good idea. So thinking ahead is really very smart. So thank you very much for that question. Here's another question which many people around the country are grappling with. And this is from a nurse who has a husband at home with advanced PD. So this woman is in the hospital, knows that she is exposed to people with COVID, uses all the correct protective equipment, but then goes home to her husband. What kind of advice can we give in that situation?
This is not uncommon. As we know, we have caregivers who are caregivers in the hospital as well as caregivers at home. They need to be applauded, of course, because those are two full-time jobs. But when you're caring for your loved ones, it's what you do. This speaks again to the whole issue of how do you maintain hygiene at home. Even when you're not working in the hospital, when you are still going to work, you bring in from the outside things into the home that you may not want, bacteria, viruses, etc. But particularly when you're working in the hospital, you are at high risk of bringing back maybe COVID-19 on surfaces, etc. So the CDC again has a great webpage on what you can do. To summarize it, you have to maybe change out of your hospital clothes at the hospital or outside the home before you come in. There has to be a method to be able to do that. You may have to shower before you actually have contact with people at home, and use the same universal precautions or social distancing that you may need to. But when you have to physically care for someone, you can't be perfect. The most you can do is ensure that you're clean. Hand hygiene is absolutely observed. A facial mask or cloth covering is worn. And these are the few practical things that you can do at home to reduce transmission to someone with advanced PD that you're caring for, particularly if you are working in a hospital or healthcare setting.
Yeah, another thing to add would be that talk with your supervisor, explain the situation, and there are circumstances that you may fall into a category where you would be transferred to an area of the hospital not directly dealing with COVID-19 patients. So there may be ways to help in that regard. So kick it up a notch and see if there's anyone that can help you navigate your particular situation. You may not be the only one who has a medically compromised person at home that needs to be protected. So definitely keep that in mind as well. So I have another question that is very important, and we're actually going to dedicate an entire session to this topic, but just to mention it now, which I know people are worried about. So many hospitals are limiting surgeries to just urgent cases. And there may be some advanced PD patients out there who have deep brain stimulation in place. They may be entering a period of time where their system is close to the end of the battery life. And they're concerned that their battery will not be able to be replaced if surgeries are not being done. And so what kind of reassurance can we give to this subpopulation that have DBS in place?
Very important question and truly realistic, because we had a scenario like this actually a couple over the past couple weeks here. So speaking from experience, I can say that the first thing that the patient and the caregiver did was contact us, which was the right thing to do, so we could help them navigate it. First thing we tried to do was to optimize medications, Parkinson's medications, if indeed the battery suddenly died, or if they were waiting to get a battery change and then COVID happened. And when that was not possible because it's an exigent situation, and people with Parkinson's need their DBS, it is their medication, so to speak. We have a protocol in place, at least in our hospital, where an emergency battery replacement was done. And as far as I understand, all is working well. In these circumstances, if emergency programming is needed, then we make ourselves available. We make sure that we wear a mask. We give a mask to the patient. It's not insurmountable. There is no reason to be anxious. Communicate with your neurologist, your movement disorder specialist, and we'll help guide you.
That's fantastic news, and I'm sure that's reassuring to many people out there. We're going to do one last question before we wrap up, and I think this is something, again, that many people are worrying about, and I think it gives us a chance to summarize a lot of what we were discussing today. And that is, can the stress of this situation make Parkinson's disease symptoms worse? What would you say about that question?
The stress of any situation, if it goes unchecked, can make symptoms of chronic disease worse. It's not specific to a Parkinson's disease. And yes, it can. And that's why I think it's a great question to end on, in terms of, again, telling people that we have avenues to decrease the stress, to decrease the anxiety level, and so you can decrease the transient worsening of Parkinson's symptoms. And I'm going to hand it over here, Dr. Gilbert, to see if you could summarize some of those things we talked about to reduce stress, reduce anxiety in these times, please.
Yeah, absolutely. I think that's key, and we hope that sessions like this, where you can ask questions and get answers, can help to reduce the stress instead of worrying yourself about what may happen in a particular situation. Please feel free to join our sessions and ask to help reduce stress. So just to summarize the various ways that we hope to help. Information obviously is number one. Exercise is number two. Definitely get out every day and interact with the world from a distance. Staying 6 feet away from everyone, wearing a face covering, but getting that fresh air is a great way to reduce stress. Doing exercise in the house, either with a video that you may have purchased or have in the house, to get yourself moving and to move as you can. And again, people with advanced PD may not be able to do such rigorous exercise, and that's fine. Just doing some chair exercise, anything to keep you moving as much as you can. Making a schedule, making sure you stick to the schedule. Doing social interactions online can also be very, very helpful as well, and keeping that engagement as much as possible. And if there is a need for people to come from outside to help reduce your stress, that is through maintaining your home health aides, then do that in the most safe manner, with as much hand washing and disinfecting and face masks all in place to maintain the lowest risk of transmission of the virus. I would like to remind everybody this session is being recorded and will be available very soon after on our website, which is apdaparkinson.org. I would also like to remind everyone that this is the first in a series of Dr. Gilbert host sessions. The next one will be this coming Friday, April 17th, again, noon Eastern Standard Time. This will be with Dr. Jason Aldred, who will be discussing Introduction to Telemedicine, which is a new phenomenon for many people, how to interact with their doctors online. And that, I think, will be very informative. And then the following Monday, April 20th, also noon Eastern Standard Time, you're going to be having a session with Dr. Natalie Diaz and Rosa Pena, and they will be discussing issues relating to COVID in Spanish. So this will be a session conducted in Spanish for people whose primary language is Spanish. And again, go to apdaparkinson.org to register for those two programs and for other sessions that we have. Everything is listed there. My final note is to warmly thank Dr. Khemani, who joined us today, for his insights into COVID and advanced PD. And we really appreciate you joining us today. So thank you so much. And we hope everybody out there stays safe and accesses the resources we have to keep everyone sane and well during this unprecedented pandemic. Thanks, everyone.
Thank you. Just like to take this opportunity to thank the APTA and also Eloise and Heather, who are doing such a great job behind the scenes to keep us on air and keep us on track. Thank you all very much, and have a great day and stay safe, Dr. Gilbert.
Have a great day. Bye-bye, everyone.